Hey there, fellow citizen of the internet. Welcome to the Moses Kabandana Podcast. Today, I have with me Blanca. I want to say Bianca because my mom's name is Bianca, but Blanca Rodrigues. And we're going to be talking about, well, introduce yourself first and then introduce what the topic is going to be.
Oh, thank you. Thank you so much, Moses. And thank you so much for having me. What a joy it is for me to be in your podcast today. My name is Blanca, like you just said. I am the owner of Wounded Healer, and my website is woundedhealer.us. And under this umbrella, I provide services as a licensed massage therapist. I'm here in the state of Florida, here in the US. I'm a certified canine massage therapist. I'm a speaker, holistic life coach. I'm into group fitness instruction for individuals 45 plus. And I'm an educator and, of course, a volunteer. And, of course, I am an Amazon best-selling group co-author.
Wow, thank you for that summary there. That's a lot. That's a lot of things that you have under your umbrella. How did you end up on this journey of massage therapists, specifically the canine? I don't think I've ever heard of a canine massage therapy.
Well, I've been doing massage therapy for almost 19 years, and I love to help people. I've been a people helper, an animal lover all of my life. I have always done jobs and I have a few careers under my belt, and it has always been about helping others in any way or form. I ended up being a massage therapist because my sister, she had scoliosis. Her scoliosis but was very severe. And back in the day when she had her surgery done, she had a big rod inside of her back. She was laying down for 6 months of her life. She was a teenager and I was a little girl. I was a pre-teenager myself, and I was like, how can I help her? And how can I help her? And I would like touch her hands or try to rub her feet. And that was the beginning of me helping others through touch. Same thing with the animals. We had dogs, and I will always be rubbing the dog. And of course, our dogs, they just love touch. So years passed. I wanted to do something related to either physical therapy or anything around those lines. And I saw massage therapy. I said to myself, that's it. I want to be a massage therapist. And after that, many years later, that I've been practicing massage therapy on tens of thousands of people. Here in the US, we have to do continuing education to maintain our licensing. I wanted to do something different. I saw massage for horses. I said, oh, equine massage, that sounds so interesting. Oh, these animals are extremely big for me. And all of a sudden, at a magazine for dogs, I saw canine massage therapy. I love dogs. Dogs are amazing beings, and God made a dog. And I said that is exactly what I'm gonna do. And canine massage therapy is very powerful. Canine massage has been around since 2700 BC, actually. The Roman Empire used massage for their animals. The Egyptians did as well. Julius Caesar, one of the things that he's very famous for, besides being a warrior, is that he used to have epilepsy. He used to take his massage therapist with him to war. His massage therapist massage his dogs, and that's one of the very famous things in history that has to do with canine massage therapy. Us and dogs, we are mammals. We have muscle groups, organ systems, feelings, emotions. Touch is the first sensation that us as babies, as infants, feel when we are born. Exactly the same with dogs. So touch is a very important part of the human experience and the canine experience as well. Research has shown that dogs prefer the touch of a human than the touch of their own. Super interesting. And the power of massage is undeniable. That's why it has been here since ancient times. The same powerful effects that us humans have with massage, the same powerful effects our dogs will feel as well. It's pretty phenomenal. Very honored to be able to massage dogs.
Wow. Well, that's for sure. For me, it's the very first time I've ever heard of a canine massage therapy. I just thought, now that you say it makes sense. If we need therapy, do animals also need physical, not physical therapy, massage therapy? It must
They
feel
really do.
good, but I just never, I just never thought that dogs needed massage therapy. So,
Yeah.
so I guess this would be a good segue for. You mentioned the importance of touch, right? Can you dive a little bit deeper into? Well, I'll follow up with that one later on. Are there people that are afraid of touch?
Yes, absolutely. A lot of
Okay,
people
okay.
are afraid of
And how do you
touch
approach
because
that?
of, well, a lot of people that are afraid of touch, the first thing that happens most of the time is that they won't allow you to touch them. But on the other
Yeah.
hand, I have worked for physical therapy offices, and it's a very open place. So massage therapy approach for physical therapy office, and I work as well at rehabilitation centers for drug addiction and alcohol abuse. So the approach is very different. You are fully clothed, it's in an open place, the massage tables are there, and people are more comfortable with the approach. I always ask him, is there anything I should know? Open communication is vital for them to feel a little more comfortable with the touch, because most of the time when people need massage therapy is because something is happening. They're either their necks are tight, their shoulders are not okay, they had an accident that they cannot deal with the pain, and that's when our approach gets easier and more bearable for these people. Now, if is in another setting like a room where you are alone with the massage therapy, definitely the approach will be entirely different. When I got massaged by a gentleman just on Saturday. This was over the weekend, and this is the most recent case of a person, an individual, which is me, when it comes to be massaged by a man. I was sexually assaulted when I was a little kid. Okay, I was sexually assaulted repeatedly over the course of my life, sexually harassed. And one of the last times that somebody touched me inappropriately was a male massage therapist, unfortunately. This was of quite a few years ago, thankfully. And I challenge myself, because I am not going to let that past experience that was horrible in my life define receiving a wonderful service from a professional in my present. So another colleague recommended me this amazing human being. The approach that I used was, from the beginning, I told them, listen, I had a bad experience repeatedly, and this, I can use it as a healer or as a trigger. Before the massage, I felt triggered. I was concerned. And I told my husband, this is the approach I'm going to use. I'm going to just open up and tell him, listen, I heard that you are a phenomenal massage therapist, but this happened to me. What can you do to help me? What is the approach? And just his face alone, I felt better. He said, the same way I massage gentlemen, the same way I massage women, and you don't have to worry about a thing. And that's exactly what happened. I didn't have to worry about a thing. He always asked me if he could approach, let's say, my glutes. I have sciatic pain issues. So working on my glute muscles is very important to help with the pain. And His approach respectful, professional. It was phenomenal, and it helped. And at the same time, this was like a win-win situation because at the same time, it helped me heal. It helped me with my triggers. It helped me with that past that is not defining my present right now. So it was a
Yeah.
win-win situation. Besides, he was a phenomenal massage therapist, and I feel so much better now.
Wow, that's good to hear that you're able to differentiate the bad or separate the bad experience from this neutral human being that's also touching you. But you're now, would you say that now you have the tools to understand that that same touch from a male is not coming from a bad place, and like what's that journey of like trying to differentiate the two, on the psychological side and the emotional side?
Oh, absolutely. In the past, when I was, I'm a sexual assault survivor for many years. The first time I was sexually assaulted was at 9 years old. It was a very dark place, very confusing, very isolated. I felt shame. I felt like, in a way, it was my fault. I didn't have anybody to talk to about it. I started speaking about it actually in the form of a co-authorship. When I wrote my chapter in a book, that's when I finally opened up to the world. And I was, let me see, this was 2 years ago. So I was 56 years old when I finally opened up. This was 47 years of silence, of shame, of feeling that I was responsible for it. But the way that I do the difference is felt. I don't really know how to explain it, but when it comes to massage therapy, because it's so intimate and let's put it this way. We are half naked on a table and somebody is working on us. To me, what is working for me tremendously well is that I make sure I approach this person and I open myself up to this person. I want to receive a good service, so I open up, I communicate, because communication is vital not only for normal life, but when it comes to massage therapy, it's vital. If you have a massage therapist that puts you on a table and doesn't ask questions, never come back to that massage therapist, because that massage therapist really doesn't care about your needs. We're all different and we have different needs when we go on a table. Open communication is important. And I'm a massage therapist, I prefer to have people open up to me and telling me briefly their experience. Hey, I had a bad experience with a massage therapist. I want to make sure that the air is clear. I'd rather have that approach, not only me as a receiver, like I was just a few days ago, but as a giver of a massage. Communication is vital. Communication is important. It changes the whole experience, not only for the massage therapist, but for the receiver as well. I can attest to that. And whoever out there has had a difficult experience with a massage therapist, we're all different. That is why there's so many millions of us all over the planet. We are here to do no harm. When somebody uses such a sacred practice as massage therapist for other purposes, that person doesn't deserve to be around. That person needs to be put away somewhere, because as a person that I am a giver and I have received disrespectful approach to a massage, not everybody is like that. Don't generalize, please. Don't throw us over underneath the bus because you had one bad experience with one person. We're all different, and our main purpose, my mission in life, not only as a massage therapist, but with everything else I do, is to do no harm and help people improve their quality of life no matter what age they are. That's my message.
That is beautiful. I think if we embrace that message of just do no harm, I think our species would be a very in a very different place. So
Absolutely.
I'm very I'm very ticklish, right? And so when it comes to getting a massage, that it doesn't even cross my mind that much, because the first thing that comes to mind is that I can't be touched. I'm too ticklish. And every time I go to the doctor or to the dentist, they always touch like underneath here. And even before they do that, I tell them, hey, I'm pretty ticklish. And still, the second that their finger touches under my, I'm just burst out laughing. So how how do you approach someone that's like either ticklish, or they might have certain sensitivities on the body, but like it's not necessarily attached to a traumatic thing. It's just I don't know why I'm ticklish. I'm just ticklish. Like how do you approach that?
Most of the time, tickle, it can be, and this is strange, but tickle is a form, it can be a form of pain because it's so uncomfortable.
Yeah.
Tickle makes us jump. Tickle, to me, tickle has never been a comfortable thing to receive. It's like, if I am ticklish, don't do it. It's not comfortable. It makes you, it makes you stress out. It creates anxiety. It's like, don't do this. The approach that I have always used on my clients, the ones that I say, oh, you know what, I tickle a lot, so let's see what we can do about it. So what I do, instead of getting into needling, doing this movement, I do compressions. Compressions are
Okay.
much more on the basic side of things, rather than doing too much manipulation, using my fingers too much, because that makes people, especially the ones that are ticklish, very hypersensitive. And yes, this area right here is a very hypersensitive area because there's arteries and veins are very close to the surface in this area. So specifically the neck, when I approach that area, there's no compressions involved, but there's no pressure. There's hardly no pressure involved. It's more of a lymphatic movement approach than muscle approach per se. There's a muscle that we call the SCN, the sternocleidomastoid, that muscle right here. Then my approach is exactly what I'm doing right now. I grab and squeeze a little bit, because this muscle right here, if you are in moments of stress, it can cause headaches. So not only the neck on the back causes headaches, but these muscles right here cause headaches as well. And that is like really only the only approach that I would do to the front of the neck when it comes to compressions. It will be compressions, never to the point of fingers and tickle. That will be definitely the approach for ticklish people. And there's a lot of people with ticklish feet. What I have done is like they keep their socks on, and that's what I do. Compressions, I grab the foot, because there's always a good approach to every need when it comes to massage therapy.
Yeah. So for those that are just listening and not watching, when she was saying that these muscles here, the muscles are like right below the jawline. It's like they make up part of
Yes,
your neck.
exactly.
So okay.
You
Okay.
grab
Interesting.
your muscle. You grab that muscle to perfection. By the way.
It's like I have practiced or something. Okay, so can you touch on the impact of not having received enough touch as in early stages of development? Like what's the importance of early childhood touch? And maybe you don't have an experience with this. I'm not sure, but do you see people coming in needing physical massage therapist, but there's some sort of early childhood linkage, like not having been touched enough? Like, is that even a thing?
Yes, definitely. And many families, I don't know why this is, there's a lack of touch, there's a lack of that approach. And as I said before, touch is a vital, touch is vital in our lives as in this human
Yeah.
experience. From the moment we are born to the moment of our passing. The lack of touch, what it causes is isolation. It causes trauma. It causes this lack of significance, lack of bonding, even feeling, excuse me, even feeling lack of love through the form of no touch. And when people people that approach massage therapy, especially massage therapy, that it has everything to do with touch, they either try it for once and never come back because they are too used to the lack of touch, or try it once and keep on coming back for more because that will be their beacon of hope, so to speak, between never being touched, never experiencing touch, and being touched in a healthy way. I can put an example: the older population, people that are in their 70s, 80s, even 90s, that here in Florida, Florida is the land of senior citizens. It's, I mean, all retirees, they always want to come to Florida for whatever reason that may be. And I have worked on many thousands of people that are in the older population. Massage therapists are basically the only people that touch a lot of seniors. They live isolated lives. They have lost their husbands, their wives, their kids are grown ups. They don't live with them. And all they have is either the touch of a massage therapist or a doctor or a physical therapist when they go to their doctors, and they build a community on group fitness instruction. I have done them both. I'm a group fitness instructor for 45 plus populations. And that is their only sense of community that they find is going to a pool class, an aqua class, and they socialize, they bond with each other for an hour, they stay a little bit after the class, and then they go back home to being alone and isolated from the world. Same thing with massage therapy. I have had thousands of older people that the only sense of touch that they receive is in the form of a massage. I have this gentleman that he is a paraplegic. He had third degree burns in his whole back because of the war, because of the Vietnam War, and he has a lot of post-traumatic stress disorder. He's very isolated. He lives alone. He does everything on his own. Very admirable because he still drives a car, and I don't know how he drives a car being a paraplegic. But the only form of touch that he receives is in the form of a massage provided by me. And it's never in a disrespectful way. No, it's that sense of touch. He really needs to receive it in some way or form. And what better way to receive it than in a form of massage, because he has a lot of atrophy, a lot of arthritis. He literally really needs a massage, not only physically, but emotionally as well. It helps him tremendously with keeping the quality of life that he has right now, which is not much, to be honest with you. So that's why touch is so important. And for people that lack touch, that grew up without touch, you can see it even in their emotions, how much of something they're really missing, which is the power of touch.
Yeah, I have circled here loneliness, right? And I think that we might be facing a loneliness epidemic or pandemic, epidemic,
Absolutely.
in our day and age. And I think a lot of it would be solved and or is due to the lack of touch, physical, intimate to any degree of
Yeah.
touch. And so can you elaborate a little bit more on that?
Yes, absolutely. Especially, since the pandemic started, since COVID hit, there's been this pandemic of isolation, of loneliness, and not only on the with the older population, but the younger population as well. And that has bring terrible consequences. People committing suicide left and right, all ages, no matter how well they are financially, no matter what. And in my experience, my daughter is 22 years old, and she allows me to talk about it because it can help others. My daughter is 22 years old. She is an engineer, and when she was in college, that's exactly when the pandemic hit. She was in a room alone, isolated, doing class in a room in front of a computer. This took her down to a very dark side of herself. My daughter has depression, but she is diagnosed with depression, and her depression only grew. She is a very young woman with what they say FOMO, fear of missing out. So her fear of missing out started growing and growing and growing, and her isolation made her feel like the walls were closing in and closing in and closing in, and she didn't find a way out. She had suicidal tendencies. She even went to a place that she was ready to do it. But she received a phone call from a guardian angel that I will always be grateful for. And she changed her mind. She has had suicidal thoughts since then. And it's because of isolation, because of being lonely, because of that lack of significance, the lack of connection. And these are basic human needs. These are needs that we need to embrace, to nurture, and to live with. I keep on talking to many people from younger generations. I share with my husband, we have 4 kids in common. They're all adults and they're all single. They don't have nobody in life. And all of them agree on one thing. Why is it so hard to have someone, to have a connection with someone, in the sense of let's be friends, let's go, let's hold hands, maybe let's take it easy on ourselves, rather than hi, I want you, bye bye. Let's make it as superficial as possible, as meaningless as possible, and move on. And a lot of people, they don't want that. They're tired of that. They're exhausted from having superficial relationships when all they want is connection. Feel significant on somebody else's life. And when there's that lack, that drives a lot of people over the edge. And this is why loneliness is definitely an open door to people ending their lives. And we see it on the so-called influencers on social media. So many and so many. I was just talking about this to a colleague yesterday. It's like so many, they're falling like leaves. And it's the younger generation. The pressure is so much and so much and so much to try to look perfect that here we go again. The walls close in, it takes you over the edge, and you end it. And I am here to tell all of these influencers, keep on influencing, but the first person that you have to take care of is yourself. And have authenticity. Don't put yourself under that very unnecessary pressure of trying to look perfect and be perfect, because us humans, none of us are perfect. None of us. And I think that's the beauty of being human, being perfectly imperfect, having our flaws, having the good, having the bad, having the ugly, falling on our asses and standing the hell back up. That is the human experience. Learning from everybody. I may be an older woman. I'm 58 years old. I'm in the middle of my menopause, and I keep on learning from you, learning from my daughter, learning from the younger generation that has so much to offer. Be open to learn from anybody, because every day we can learn something new. Don't close yourself up by trying to pretend that you're all omnipotent and almighty, when that's not true. And there's beauty on being authentic, on being vulnerable, on not knowing everything, because it's not true. We don't know everything in life. We just don't. I think this human experience is about change. Change is unavoidable, and the most secure thing we have in life is change. From the moment of conception all the way to the moment of our passing, change is unavoidable. Change is here to stay.
Change is definitely here to stay. Yeah, and I hope this loneliness pandemic goes away slowly, or
Yes,
well,
absolutely.
it's gonna be a tough battle to get over. But yeah, the lack of touch, that we're experiencing today is unparalleled. And so
Yes.
speaking of which, um, correct me if I'm wrong, but there is an increasing number of people, or maybe it's always been this way, and we're just starting to talk more about it, of being uncomfortable with your own body. Like, people are not comfortable with their own bodies, and like for example, like just standing in front of the mirror 100% naked and being comfortable with just looking at yourself, right? I feel like that's not a thing that happens enough. And so the question that I have for you is how can massage therapy play a role into increasing someone's ability to be comfortable with their own body?
In my experience, there has been, I mean, this is the beauty of working in so many people, because I have met many personalities, many people with different needs and different traumas, different losses. I relate a lot to that, being uncomfortable in our bodies, looking at the mirror and not wanting to look at the mirror. When I was in my younger years, I had a severe case of body dysmorphia. Dysmorphia is seeing something that is not real in the mirror. For example, I've been a dancer for over 40 years. In the world of dance, if there is a world where body issues is rampant and it has been a severe problem for many generations, is in the dance world. In the dance world, everybody wants to be skinny, everybody wants to be skinnier, and I was not an exception. I always wanted to be like the other one and this one and that one and that one. And it was unhealthy. I was body dysmorphic. I wanted to have what they call a six-pack, have my abs showing in the physical world, and I could never see it, and it's like, oh my God, what is wrong with me? I'm exercising so much, I'm dancing so much, I'm doing my best, I'm doing. And the first mistake, big mistake, and that a lot of people like myself have done, is comparing myself to others, comparing myself to how others look. All bodies are different. We build our muscle mass differently. Our muscle mass, we all have the same muscles on our bodies, but how big or small these muscle constitution is, that is another story. It depends on our DNA. It depends on so many things. But going back to issues with the way we look, I used to look at the mirror as a dancer, okay? I will look at and admire my dancing. I would look and admire when I would put my makeup on when I was going out. I would look and say, oh, okay, this looks good. This looks good. Not I look good. This looks good. This dress looks good before going out. And oh boy, did I have an issue of not looking in the mirror naked. Okay, I didn't look at myself in the mirror naked in my young years, and oh boy, what a waste of time. Definitely. It's very powerful. A powerful exercise that I recommend to anybody and everybody that it helped me tremendously with my body dysmorphia was stand in front of the mirror, face first, and start saying, wow, you look good today. Hey, Blanca, you look good today. Wow, that dress looks so good on you. Even if consciously you don't believe it, this can really help you to change your mind, because when you change your mindset, your life will change. And going back to my body dysmorphia, I always saw something, a flaw. I always saw something that it was wrong. I always saw something that had to change. I always saw that my body is not perfect. Here we go again. We're not supposed to be perfect. You know, we're not supposed to be perfect. A fit body, a healthy body doesn't have only one form. There's many forms of being healthy, many ways of having a healthy body. That is a fact. And I was focusing on that skinny girl, that she was a ballet dancer and she had very lean muscle. Well, many times that very skinny girl had problems of bulimia or even anorexia. Okay, and in the dance world, this has been something that has been really, really terrible, a very sad thing to deal with. And it's not only till pretty recently when these issues are being approached and are being worked on, because I heard so many times from choreographers, from teachers, hey, you're fat. Hey, you're fat. What does that do from an authority figure to a dancer, to a student, to the young ones that are in the classroom? It's like, oh my God, if she's fat, wow, I have a problem. Years later, after I dealt with my body dysmorphia, and I'm very happy in my body right now. I'm grateful for this body. I'm grateful for movement. I'm grateful to be here. I'm grateful to be able to be a woman in my late 50s, and I'm still teaching dance. I'm a teacher. I'm a Zumba dancer. I'm a Zumba teacher. And it's like, wow, what a blessing it is to have a body that still is in motion, that is still moving. Movement is medicine. And I look at myself in the mirror and I say, thank you. Thank you, because after all the mental, emotional, and physical crimes that I committed with this body, because I was so traumatized, I was insecure, I had low self-esteem, and what do these things lead us to? Self-destruction. So I put my body into a lot of self-destruction. I said, wow, I'm still here for a reason, and it's to help others. I learned the lesson, getting the help that I so very much needed and deserved. I got psychiatric help. I did group therapy. I picked up on books. I went to seminars, masterminds, you name it. What does not YouTube University have for self-help? I do guided meditations every single day, and I put any YouTube channel for a beautiful guided meditation. Gets me going for the day. How about practicing some gratitude for the simplest things we have in life, like being able to get out of our bed and go to the bathroom and brush our teeth? That is a blessing right there. I have learned through my experience, not only as a massage therapist, but in my personal experience with my own mother, that she lacks a lot of movement because of older age, that really movement is a blessing. Moving is a blessing. Movement is medicine. It keeps on going. It keeps us healthy. I remember, and I always say this, Hippocrates was the father of medicine. He always believe that with physical activity, rest, music, fresh air, good eating habits, and massage therapy, the body will stay in a healthy state. He was absolutely right. Till this day, it's like, wow, I totally believe with this powerful person said all the millennia ago that is still very much the truth. And the more we keep on moving, the more physical activity we have, the more going outside, how important it is to go outside for clarity of mind, for full oxygenation in our bodies is so important. I highly recommend to anyone, if you have body image issues, the first thing that you do is don't listen to anybody in social media, because it's too much the pressure. These people really don't know who you are, don't know where you come from, and the pressure is too much. It's too much to show an image of one body. Oh, this is the perfect body image, when that is absolutely not true. We're all perfect with who we are, as long as we accept who we are first, and accept others for who they are, for what they look like. My stepdaughter, she is in school for personal training. She is a big girl. She is a big girl, but her muscle mass is phenomenal to look at. And she insists that it's like, you don't have to be a skinny ass, tall, model-esque looking woman to be healthy. And she is pursuing that because of so much trauma that she endured because of being a big girl and a small frame. She's full 4'10", so she's a small lady. And she is 200 pounds. And this is what happens. Don't stop the more we stop comparing ourselves to others, which I did for a very long time, the healthier we will be. The more, here we go again, my quality of life went up the roof once I stopped comparing myself to others. And the curious thing here, Moses, is that I look at a picture from many years ago and I was like, I didn't see that I really have a six-pack. That muscle definition was really there. And years later, I look at that picture, it's like, wow, I had that muscle definition. And guess what? I never saw it. Isn't that something?
Right.
The way the mind works? Yeah.
You just dropped a whole lot of nuggets there for us, and just bringing the I don't know who said it. This is a disservice to the author, but that comparison is the thief of all joy. It's a very well known quote, and I like to add a little bit to that and say to the degree that it's useful, right? Comparing ourselves with our surroundings is something that is inevitable. Like, we have to see where we stand within this larger societal structure, right? But to the degree that it's useful, it stops being useful when James gets a better car and then I have to get a better car because James got a better car, right?
Exactly.
So
true.
but it's that the ability to compare ourselves with our surroundings is inevitable, but it has to be taken within context. It has to be implemented to the degree that it's useful. If you're very thin and you're dancing and everything, but your abs are not as well defined as the other person that is dancing, you might not be able to see that, right? But continuing to pursue that beyond the necessity of having abs, which I don't know, I guess like mobility enters the equation. Like, one of the benefits of being thin and being a dancer is mobility, right? But beyond that ability to dance, when it stops being useful, then you have to let it go. You have to let it go.
That's right.
So as we're coming to a close here, I just want to respect our hour here. Any final thoughts that you want to leave people as far as the relationship between touch and healing?
Absolutely. Touch, here we go again, is one of the basic human needs. This is something that we are born with. And touch for healing. Touch for healing is amazing. And This is the thing, something as simple, but and it's not complicated, as elaborate as touch can make such a difference in anybody's life. Not only in the form of massage therapy, but in the form of just shaking a hand, in the form of like my husband when we are here at home, that he rubs my feet because I work standing all day long and I rub his feet. How important is that connection? Touch brings connection. Touch brings to me, touch is compassion. Touch is empathy. Touch is vital. Touch is to me, touch is like basically like air. It's something that we do need. It's something that we live better lifestyles in the form of touch. And this is why loneliness has been so detrimental for so many, that unfortunately many don't survive it. And touch, of course, for healing. Not only as a healer that I'm a massage therapist for all of these years. And yes, I touch for healing, but a hug can heal. A shake of a hand can be a healer because it means connection. It means love and connection. And not in the sense it's like, hi, I love you. Well, I have met people that I say, hi, I love you. But in the sense that it's connection. It's connection. And in this human experience, we cannot be without connection. And touch has everything to do with connection. So I highly recommend to our listeners out there, find a way to shake a hand, find a way to give a hug. How important is something as simple and special and joyful as a hug? I am a hug offerer. I have many patients that are in very dark places. These are recovering addicts and recovering alcoholics, and the root of their problem is not the addiction. The root of the problem is trauma of some sort of and of some sort of style. The stories of these people can be, inundated with very dark seasons in their lives, very traumatic seasons. I cannot, if I start talking about the traumas that some of these patients have shared with me, we will be here all day. But touch is very important. And give a hug. Don't be afraid. A hug doesn't mean being invasive with someone. I always offer hug. It's like, do you want a hug? Come on, give me a hug. And people are really willing to receive it. And shake a hand, smile, have that connection in some way or form. Open a door for someone. Help an elderly person cross the street. It's very important. It's very significant. And not only the person that receive it will feel better and feel love, but you will feel better yourself as well. That's my recommendation to all of you. Mm-hmm.
Awesome. Blanca, thank you so much for coming to the podcast. If people want to know more about you, where do they find you?
Yes, you can find me. My website is woundedhealer.us. That's my website. You can communicate with me there. My phone number is there. Text me, email me. I am here for you. I'm here to serve. And definitely, I am here to help people improve their quality of life no matter what age we are. Thank you, Moses. This is a joy and an honor for me to be here. Thank you.
Thank you, and a happy Tuesday to you.